lifestyle medicine. His topics include COVID-19, childhood and immunity, vaccines and COVID, pediatric COVID, lifestyle medicine, and COVID-19, chronic disease prevention, treatments, and reversal of diabetes type 2. So the list can go on and on. So we have a true specialist who will be able to answer your questions. And again, Dr. Graham, I thank you for taking the time out. Before I let you speak, let's have a word of prayer, and I'll pray. Dear Heavenly Father, we thank you for the day. We thank you for life, strength, and health. But Lord, you gave us our bodies, and they are a temple, Lord. I ask that every word that we speak today be pleasing to your sight. I pray that this will open the minds to everyone that's listening, that they will make conscious decisions to take care of their health and to be more informed about the COVID vaccine. We thank you for today and all that you're doing through us. And we ask that you guide and protect us. In Jesus' name, amen. So if you want to, Dr. Graham, you go ahead and take over.
Okay, well, it's a pleasure and a delight to be with you wonderful people and all those other wonderful peoples that are listening or are tuning in via various platforms that we have available today. It's a privilege of mine to be able to share information. It's very important that we have sound information. Certainly we have opinions, but it's best if we try to look to facts that help to shape our decision making. And this is a very important time. And I just want to lay a few facts out there of information that I have gleaned from our experience, and also information from studies that have been done and research in this area, and information given out by the CDC also, and the ACIP, which are bodies related to immunization and guidance on panels. And this is what the type of source that we're going to be using with this type of information. And so bear with me as we go through some things that I wanted to mention. Do not be overwhelmed by what you see, because it's basically, I'm going to explain some basic things. Now, so this virus, the coronavirus, SARS-CoV-2, really, it's not a new virus as people would think, but the cousins have been around. As you can see here, let me make a little pointer here. Here we go. Okay. As you can probably see here, we have the SARS-CoV from 2002 that we experienced from China, and that we thought was probably through bats as reservoir and the civet cat. And then in 2012, we had another outbreak of the MERS in the Middle East, which also we would thought the hosts were bats again, and the intermediary host was camels. And then now we have SARS-CoV-19, and so SARS-CoV-2 in 2019, sorry. And there's lots of theories as to where this may have come from. However, we do find a lot of similarities in the horseshoe bat. When you look at the genetic material of SARS-CoV-2 and the horseshoe bat. And we're not too sure how it jumped across to humans. It could have been certain exotic animals like the pangolin. But these are very, very hypothetical at this time. Now, remember that about 2 weeks ago or 10 days ago, a team of international scientists went over to Wuhan to see if they could glean information. So we don't have all the facts on that, and maybe we'll never have how it got to us. But one thing we do know, these very, very minute particles, less than 2 microns, that float around, 2 to 3 microns, end up in the air on objects and get to our lungs, as you can see, through our upper airways and down into our airways and down into our lungs, and even into our GI tract and through our whole body. And as you can see on the right, basically our body has receptors which allows it to get into the cell. And we're going to talk just a little bit about that, but just a quick overview. And now we have a situation where we have 2,500,000 deaths, sad to say, around the world. Who would have thought a year ago? And now after a year, we now have more than 2.5 million deaths around the world. And things are not getting better around the world. They may be improving somewhat over here, but I wanted to just break down some important things for us. Now, in this country, we see that when you break down the population by race, we have 60% of the population is white, Hispanics at 18%, the Black community, African American community as 13%, the Asians at 5.5%, multiracial 2.8%, and 0.7% of native peoples. Now, why am I mentioning this? Because I want to bring us to a point as how this is affecting disproportionately certain groups of people. So if you look at this graph, you'll see that non-whites, the blue is how much population, the 60% that you saw in that chart before. And this is what percentage of them have confirmed cases. So there's, of the larger group, which is the white group, 36% of these people are infected, get infected, of the group of people who have COVID. Hispanics, which are only 18% of the population, 33% of those who have COVID, confirmed cases, have disproportionately COVID. The Black race also have another disproportionate amount. Look at the amount of blue, which is the percent of population, and now look at the amount of confirmed cases in that population. So we see here that the largest population only has 36% of the cases, and a very small population of 18% of Hispanic in the population by race, they have 33% of the burden. Equally, even the Blacks, who are only 30% of the population, they're having 22% burden of these cases. There's something going on here. And there are multiple factors, and we could talk forever and ever of some very, very saddening or interesting elements that point to why is it that we're getting that. And maybe another time we can go into more depth into that, but we're going to look into that just a little bit. Now, when we look at COVID by age, we also see another startling. And just taking one example of the Connecticut Department of Public Health, they showed figures over here where you can see actually from 30 years of age, the yellow portion of the pie chart, all the way over to the blue section, which is 60 to 69. These are the burden carriers of age that seem to succumb to COVID more. So between the age of 30 all the way to around 69, we're having the larger burden and of disease, and mostly between the red area, which is 50 to 59. And we see the people who are really, really having a hard time with mortality, dying, are those who are over than 80 years and over. And also there 57% of deaths are in that age group, 80 years and over. And if we look at those who are 70 to 79, 22%, which is also a national representation as well. When we get dig into another area, which is really sad, we look at comorbidities, other illnesses, chronic illnesses that this population, the US population, seems to have. Check this out. Hospitalizations were 6 times higher and deaths were 12 times higher for COVID patients with reported underlying conditions. And if you try to layer them, let's say you have cardiovascular disease as well as diabetes, and God forbid you also have chronic lung disease, then the percentages of rates of increase go up higher. So we're seeing that you are 6 times more likely to be hospitalized, but 12 times more likely to die if you have one of these chronic diseases. And these chronic diseases are very common in this country and around the world, but let's speak about here. Don't be shocked by this graph. I just want you to focus on underlying medical conditions. Obesity, 31%. That's in the country, in the US. Diabetes, 11% in the US. Chronic lung disease, 7% sorry, in the US. Heart conditions, heart disease, 7% in the US. And chronic kidney disease, 3%. And so 41%, there's a national prevalence. 41% of this population has chronic medical conditions. That tells us that the answer is not just a shot in the arm. There's a bigger answer. And that's why I wanted to address this issue today. For us not to be feeling that we're just going to take a pill or take a shot and everything's going to be okay. There's much more to this than just getting a shot. However, we see that things are improving. And we see that after January, the rate of infection dropped and has been dropping. And that's good news. And I'm not here to just give you all bad news. And that's why I'm showing you this graph. You see how it goes up and peaks when we're having a good time in Christmas and everyone's getting together on New Year's and Thanksgiving. And then after that, things got better. And there are multiple reasons why we can look at that. But one of the things that got better, but because what didn't get better was our diabetes and our chronic lung disease and chronic kidney disease didn't disappear. But we certainly did change our behavior a little bit. And one of those things was that now we have more than 70 million doses of vaccines given. There are some changes when it comes to the type of virus, but we're going to look at some of these things. Now, the things that we do that mitigate, that can change the burden of disease and how much this bug is affecting us is, and I want to reiterate this, we cannot stop doing these things. Washing our hands frequently, covering our mouth when we cough, cleaning surfaces that are frequently touched with the right kind of solutions, social distances, being 6 feet apart, avoiding large crowds, using a mask and using it properly, not just over your mouth, but over your nose and not under your chin or over your forehead. And if possible, in certain environments, even double masking. And there's a picture of me on there on the far right and getting your vaccine. And I was privileged to get my shot back in December. And then we look at all these things we can use to help mitigate, to reduce the spread of disease and us actually getting infected. But there are healthy lifestyle effects on disease process that we need to be aware of. For example, positively affects gene expression. So there are healthy lifestyle decisions that we can make that actually affect our gene expression. Listen to that. It's called epigenetics. We can look into that. Reduce insulin resistance, reduce chronic stress, reduce inflammation, provides antioxidants and more. So there are lifestyle modifications that we can actually do that actually affect the way disease affects our body. And I want us to look at this carefully because the American Heart Association and the U.S. Preventive Services Task Force have clearly seen that there's strong evidence that tobacco cessation, increased physical activity, and making dietary changes, these things can actually decrease morbidity and mortality from heart disease, cerebral vascular disease, and cancer in adults, according to large studies that have been done. We also know that even nutrition counseling has been shown to be effective in changing dietary habits and has been shown to reduce medication costs. The World Cancer Research Fund and the American Institute for Cancer Research has shown that 1/3 of most cancers in this country could be prevented, 1/3. The 4 main lifestyle factors that can be modified: tobacco and alcohol use, lack of physical exercise, dietary factors, obesity. There are 340,000 preventable cancers in the US each year. And so we see that even consuming healthy diets is associated with a lower risk for chronic disease, morbidity, and mortality. You know, even if someone is not overweight, listen carefully now, if someone's not overweight, eating a poor diet is associated with major causes of morbidity from the following things: heart disease, stroke and high blood pressure, type 2 diabetes, osteoporosis, some cancers. You see, health behaviors, they may decay after you make some changes in your life, but studies have shown that when we change our behavior, sometimes 50% of these behaviors can continue even after 18 months. And these changes that we make in our lifestyle, you can actually do a person's blood levels of cholesterol or even their markers for diabetes. And within 2 weeks, you've actually changed those levels of cholesterol and levels of markers of diabetes like the HbA1c in 2 weeks. And so these are things that we know can make a major impact that we should not look on lightly, as we have seen that 40% of the US population have some form of chronic diseases. Now, we go to the factor of vaccines. One of the arms, one of the very important arms. Now, the CDC have stated that the federal government is funding and coordinating the development of multiple vaccines candidates, several of which are in large-scale phase 3. Now, we know that some of those phase 3 are actually finished, and some which have actually been authorized. COVID-19 vaccines are being held to the same safety standards as are all other vaccines. Now, what kind of vaccines currently do we have? And I've just picked out a few because there's a long list of over 150 vaccines that have been looked at. These are the prominent ones so far. The AstraZeneca one by Oxford in the UK. And that one, the type of vaccine, that's a viral vector. It's genetically modified virus. So in other words, they take a cold virus, let's say adenovirus, and they weaken it, and they put genetic material in there with instructions for it to make a certain type of protein that will then go on to trick the immune system to think that it has been exposed to this virus. And so when they see it again, the body will say, okay, I've seen you before, let's attack. That one has been seen to be 62 to 90% effective. The word effectivity is important versus efficacy. Effectiveness is what happens in the real world. Efficacy is what happens in a controlled trial. So this is looking at what happens in the real world, but this is with 2 doses. And then you have the Moderna, which is a different type of a vaccine similar to the Pfizer one, which we have been using a lot here, which is the Moderna and the Pfizer. These are RNA vaccines. And you know, we have DNA genetic material, we have RNA genetic material, and our body uses this information to really give instructions to produce proteins. However, the RNA is then placed into a lipid packet and then injected into the arm, and it goes into the cell, only into the cytoplasm, not into the nucleus, and given 2 shots, and it's shown to have 95% efficacy, in which it prevents the person from having illness, COVID disease. Then you have the Sputnik, which is a Russian one, which is another viral vector with 2 doses and has been shown to give up to 92% effectivity. Now, we just want to make mention of something important, which is the phases of trial. A lot of people are not too sure about what's going on here. Have we just had 1 phase and all of a sudden we've produced a vaccine? No, we've had the same 4 phases. First, phase 1, we want to pay attention to that. Researchers try to answer this question. Is the vaccine safe? Are there any serious side effects? How does the vaccine dose relate to side effects? And is the vaccine causing an immune response? That's happened within like 20 to 100 people. And then you move on after that, when you've answered those questions, to phase 2, which is, researchers tried to answer what are the most common short-term side effects? What's the body's immune response? Are the signs that the vaccine is protective? And then when you move to the phase 3, you then add not just several hundreds, but thousands of volunteers. Researchers tried to answer these questions. How do disease rates compare between those who get the vaccine and those who do not get the vaccine? How well can the vaccine protect people from disease? And when you get to stage 4, the vaccine is approved. Researchers tried to answer these questions. FDA approves a vaccine only if it's safe, effective, and benefits outweigh the risk. Researchers continue to collect data on the vaccine's long-term benefits and side effects. Now, mRNA technology and vaccine safety monitoring. The COVID-19 vaccines that have received FDA Emergency Use Authorizations, there have been 2 of them. Pfizer.
Si quieres poner aquí, te está hablando de la importancia de
95%.
Yo lo tengo aquí, pero es que voy para arriba. Si lo quieres, ponlo aquí, yo vengo ya mismo. Yo vengo tan pronto.
94.5%.
Este es
¿Eso es todo lo que?
eso.
Both are mRNA vaccines.
Este es el pasto.
¿Qué es?
El número del meeting,
People being vaccinated should complete 2 doses.
si lo quieres poner, ahora mismo, sí.
Now the
¿Qué
duration.
hace la vacuna cuando te la pones? Te habla-
No, no. And I've left some information, and I'll make it available as to more information on what we can have on these 2. Now, the vaccine trials, as of December 21, we're now, this was a later slide, but so that you can get a quick snapshot, when the Pfizer enrolled 45,000 people, whereas Moderna,
Yo no sé cómo hacer eso, yo lo tengo aquí, yo lo di a ti.
and so we basically have between the 2 a good 75,000 people that
Al Zoom y puse el número que está ahí arriba.
No, pero
see that there were 150
Oh, man, Nylon, a las 3:30.
pero yo te digo algo para que tú...
sites in the
Sí,
United
ella
Eso tú me lo puedes
pues
hacer.
eso fue lo que yo te di en la servilleta.
Mamá, me lo fue directamente y ya yo no hago más nada.
Here's some feedback.
No funciona. Yo traté de hacer eso y no
All right.
sale.
Now, the vaccines that are available in the United States at this point in time are the mRNA vaccines. And I think it's important that I pause here and explain a little bit about this. Now, I mentioned that the vaccine has genetic instructions, messenger RNA, that are placed inside of a bubble, a little package. And this nanoparticle is then injected into your arm. It then goes into the cell, and the ribosomes translate it into a protein. And that protein is what we then have on the surface of our cells. And it then acts as a tag so that our immune cells come around and say, oh, there's somebody foreign around here. Let me see if I take a picture of this and I'll remember what it is the next time it comes around. And that's what's done. mRNA vaccines do not affect our DNA. Why? Because it's incompatible for DNA to be going inside of, the RNA to go inside of the DNA. And so this new technology allows for the RNA then to dissolve in the cytoplasm. So when it gets here, it then dissolves and breaks down, and all the lipid particles are taken care of and removed from the cell and goes out here with the byproduct, but does not end up inside the nucleus. And so some of the misinformation out there on the idea that it changes our DNA, it's incorrect. mRNA vaccines are new, but the technology is not. Actually, before 2002, when the first SARS-CoV infections occurred, there had been people working on mRNA technology at least 10 years prior to that. And it has been studied even in influenza, Zika, and rabies, and cytomegalovirus over years as potential candidates for vaccines. And as I mentioned, this is a regular cell. And you see here, this is the nucleus where our DNA is. The mRNA vaccine only works inside this area, which is the cytoplasm. It does not go into the area of the nucleus. And so it does not change your genetic material. It does not change your DNA or any genetic material inside of you. Now, what is this slide? This slide is a very, very simple slide. There are two lines I want you to take note of. On this side of the curve, there's how many people are getting infected, and down here, how many days after your first dose. This is the vaccine people here, and this is those who got the placebo. And so you can clearly see that people who got the mRNA vaccine, they stayed at very low, extremely low case rates. However, those who did not get the vaccine exponentially had increased rates of infection, which is what we use to show the 95% efficacy of this vaccine. Now, at least 8 weeks of safety data were gathered after participations, after they received their second dose. It is unusual for side effects to appear more than 8 weeks after vaccination. And we're not just talking about the COVID vaccine, we're looking at all vaccines that we've been using over the last 50 years or so. But these mRNA vaccines produce common side effects, and you should be aware of that, because when I got my vaccines back in December, I had all these. I had fever, headache, and muscle aches, and I had it for 2 days. And one of those days, I think I didn't go to work. No significantly safety concerns were identified in the clinical trial. They had 70,000 people involved in the trials, although a small number of severe allergic reactions have been reported during the initial phase of rollout. And let me make mention of that, because specifically, now looking at now, between December, late December, and now in February, there basically were 13.8 million doses of the Pfizer and Moderna vaccine given. So remember now, in the clinical trials, they only had 70,000 people volunteering. However, now we have 13.8 million, but that's not anything as yet, because we actually now have 70 million doses of vaccines given so far. And so the rates of allergic reactions from vaccines have stayed at the level that it should have, and also at the level that we expect for a population in that time to have allergic reactions. Now, safety of COVID vaccine is a top priority. COVID-19 vaccines are held to the same safety standards as all vaccines. FDA Vaccines and Related Biological Products Advisory Committee reviews applications. The Advisory Committee on Immunization Practices considers safety and efficacy before recommending its use. And these are independent bodies, these are not government bodies. The VRB PAC and the ACIP are independent committees composed of scientists and clinical experts. The FDA and CDC monitor vaccine safety and side effects once vaccines are in use. And I actually today, just before giving this talk, even though I got my vaccine back in December, I got a text. I get a text every week wherein it asks me very specific questions trying to monitor the safety of the vaccine. Now, how was this vaccine developed in such a rapid time and having to ensure its safety? Well, researchers used existing clinical networks to begin conducting COVID-19 trials. And that's usually a big thing for those of us in the era of research. To get any kind of clinical trial, you have to have a network. And to get a network, you need to have a place and lots of people who are willing. And we already had these places in place. Now, manufacturing was started while the clinical trials were still under the way. So that's the trick here. The manufacturing was started while the clinical trials were underway, which we will see later usually happens long after. Normally, manufacturing doesn't begin until after the completion of the trials. Messenger RNA vaccines like Pfizer and the Moderna are faster to produce in large amounts than traditional vaccines because they don't have to grow anything. And there's lots of other things. Now, FDA and CDC are prioritizing review, authorization, and recommendations of COVID-19 vaccine. Now, here is something that I think we all can appreciate, the typical vaccine timeline. 2020, now if we were dealing with vaccines in the past, you'd have to wait until 2034. So you're talking about 14 years, 10 to 14 years to get a vaccine going. That's the typical timeline. You get the research, then you get the preclinical, then you get the phase 1, then you wait for your phase 2, and you wait for your phase 3, then you start building factories, and then you start manufacturing, and then you get your approval, and then you distribute. That has changed with COVID because of the devastating impact this has had on our families and our community around the world. Look at the vaccine timeline today compared to years before. Today we have it now down to a very small period in time within which research, preclinical, phase 1, phase 2, phase 3, build factories, manufacturing approval happened within a year. And if we look, stretch it out so we can see the details, this is what happened. So while the research was ongoing long before 2020 on COVID vaccines, we then began to see, when the disease came, we had preclinical, in which we started to look more on the bug itself and getting information on immune response, and in cellular and experimental phases. And then phase 1, and we looked at phase 1 where you have 20 to 100 people. And when we started to see that we could then go further, while we were doing phase 1, we moved on to phase 2. And at that same time, while we saw we were getting good results from phase 2, we immediately moved on to phase 3, which you had thousands of people, talking about 75,000 people, but 40,000 for Pfizer and 35,000 for Moderna. But the building of the factories to produce this happened with the more than $10 billion of money given by the government to help these private bodies to produce these vaccines along with the US government and get everything ready long before, so that, as you know, for every 10 vaccines that are tried to produce, only one of them will make it, and that's billions of dollars lost. And so the government had to come in to help to fund regardless, because if it didn't work out, the money would be lost anyway. Whereas manufacturing also began in stage 3. And the approval then, when phase 3 began to show that the effectiveness and efficacy was great and the safety was sound, and then distribution as we know it occurred. And so COVID vaccines cannot give you COVID-19. And we've seen why, because you've been given instructions in an injection to produce a specific protein. And so I got fever, headache, and joint ache, and I felt sick, but I didn't get COVID-19. People who have already gotten sick with COVID-19 may still benefit from getting a vaccine. As something that's being looked at carefully. Because let's say you had one vaccine, and then all of a sudden you got COVID in between, because there's a small percentage of people who can still get it, or because you got infected in the time when your body is producing the antibodies, which is usually around day 5 to day 7. Getting vaccinated can help prevent getting sick with COVID-19, and we saw that. COVID-19 vaccines will not cause you to test positive on COVID-19 tests. And I wanted to just leave time now for us to go into some questions. Latoya, can't hear you. Can't hear you.
Sorry, I forget to unmute it. There was a few questions in our chat room. One question was, we often don't eat GMO food. Should we take in a GMO vaccine? I don't know if that's even possible. I don't know.
Okay.
I guess in terms of the right foods that we should eat.
Yeah, I mean, the question is, I can't speak for that question, but generally speaking, a lot of people have the feeling that genetically modified foods may not be the most healthy food for it, because maybe it may, I don't know of it doing that, but the people may feel that it may affect their genetic makeup, which we have no evidence that it does. And so I think maybe the person may be thinking that it may affect also their their genetic makeup if they eat genetically modified foods, which is no evidence for that.
Another person wrote, is there any danger in taking the COVID-19 vaccine if I have an allergic reaction to zinc or iodine?
No, if you have a strong allergic reaction to anything, you should let your PCP, your primary care, know about that before you make that decision. But if you have a strong allergic anaphylactic reaction to anything, that's one of the contraindications to getting vaccinated. So we need to be very, very careful about allergies, and that's something you need to discuss with your primary care. If you have ever had a severe allergic reaction to any ingredient in the COVID vaccine, which is there's no zinc in there, you should not get the vaccine. If you have had an immediate allergic reaction of any severity to other vaccines or injectable therapies, you need to really reconsider if you need to take that vaccine.
Okay. I actually did get the COVID vaccine, and my first dose, I'll just say my reaction was, I was just really tired. I didn't have any fevers or didn't feel ill, but I just felt really tired from the first dose. I did have the Pfizer dose, and my second dose, I just had little muscle aches and pains just in my neck. That's it. And that lasted for maybe a day, and that was all my reaction was. So, but I will say I was very leery about getting the vaccine, and so to speak, I was chickening out several times before I actually got it, and since I've gotten it, I have felt better about it. Another question was, once vaccinated, will all subsequent COVID-19 viral testing be unreliable positive?
No, as I mentioned, that will not affect your testing.
There's also talk about the Johnson & Johnson vaccine. Do you know any more about that vaccine?
The Johnson & Johnson vaccine, we're looking at a vaccine that's different in the way that it's made, correct? And that vaccine is more based on similar to like the British one, which is basically using a viral vector, and that way the patient gets the same exposure to but the delivery is different. So you're ending up with the same protein that's being produced. The difference is it's being delivered differently. But has been shown to protect against severe disease and death, at least over 80%. For generally speaking, it's lower as far as the general illness after its first dose, which is the dose that's given, at 60 to 75%. But certainly abroad, it's been shown to go up to 70%.
Okay. During this COVID-19 and while everyone was on quarantine, a lot of folks gained weight. So we're all having to deal with that COVID-19 weight gain.
Yes.
And so in terms of our health and getting our getting back and doing these preventable things to keep us from cancer and heart disease, we've almost did a step back as far as trying to be a little bit more healthy.
Yeah, and that's why I spent a little time mentioning that we shouldn't just be depending on a vaccine. We need to be looking at our lifestyle, because if 40% of us in the population have have chronic disease, it means that, and I showed clearly that you're talking about a good 12 times more likely to die.
Wow.
6 times more likely to be hospitalized from COVID. So, yes, the vaccine is going to make an impact for us right now, but going forward, let's say the vaccine fades out, it affects fades out at 8 months. We don't know, at a year. And you forgot to get your vaccine and you're naked again. You have no protection. It goes back to your body. You need to, or we need to be cautious about our lifestyle.
Yeah, I was a little shaken up that there are 340,000 preventable cancers. That's a lot of cancers that can be prevented. And like you said, it's just going back to a healthy lifestyle. And you know, I went back to the gym for the first time yesterday, and I was leery about going because, you know, so many people are going back to the gym, but they're not wearing a mask. But I figured, well, I have the vaccine, so maybe there's some protection. And but I don't want cancer either, so I'm trying to do these modifiable changes and trying to live a healthy lifestyle. And so I encourage everyone to get out there, get moving. Don't stay on the couch, and let's prevent these diseases and things that we can change. And lifestyles are one thing we can change.
Yeah, you know, I mentioned something that I want to go back to, and that was epigenetics. What on earth does epigenetics have, and what does that mean? What does that have to do with anything? We all have been given baggage by our parents and our grandparents as far as genetics are concerned. There's very little you can do about that. You were given that, okay? However, we all have genes that are suppressed, that are very dangerous genes. Some of them are cancerous genes, and many different types of genes. And our lifestyle can suppress that, or actually accentuate the exposure of that gene. And so we end up getting those diseases earlier on in life, or getting the complications of those diseases earlier than what we should have. Because even in the studies done with the Seventh-day Adventists way back in the 20 years ago, and even the recent ones that came out looking at large studies, some of the largest study on chronic disease and lifestyle, it showed that even though in California, Loma Linda, Adventists were living 7 to 10 years more than their counterparts who were in the community, and these are Adventists that were following basic lifestyle modifications, and also vegetarian or partial vegetarian or pescatarian, these people died of the same diseases as their community counterparts, but later.
Wow. So
you end up with the same diseases, however, you get it later on, 10 years later. So we're going to end up, if the law doesn't come before then, you know, succumbing to something. However, we can decide when it comes on by our lifestyle. So we know, for example, certain types of foods cooked a certain way or preserved in a certain way that we ingest, or certain kinds of lack of physical activity can promote certain kinds of cancerous genes, or genes that promote diabetes, etc. And so being aware of that, we need to understand that we can change these things if we make these kind of lifestyle decisions now.
Wow. Another question was, how long will we have to continue wearing a mask?
So I believe that the person that asked that question, if we both answer that, we become billionaires. Because no one knows the answer to that question. You know, it's a very difficult situation that we're living in. But remember when SARS-CoV-1 came in 2002 and struck and killed quite a lot of people, nothing like what we have now, especially in China, they were wearing masks, and after about a year and a half, 2 years, they decreased the use of it. However, they still wear masks, even when we didn't have, in a lot of Asian countries. If you have a little cold, they wear a mask, and people just take it as a, you know, they're protecting us or we're protecting them, vice versa. So we may see that, and it's people used mask less and less and less and less. So we may see that that will go away as the virus changes and as our behavior changes, and that can go either way. But I do believe from what I'm seeing and from what we've seen in the past with all these other infections, that will certainly ease up, but we will have to pay the price if we don't do what we're supposed to be doing in the meanwhile.
Would you say that we've had a decrease in even people getting the flu, just because we've already been wearing the mask? I wonder what our flu rates have been for this.
Yeah, that's a good question, and I get asked that every day in my practice. But so far, I've been following this for a while, and I gave a talk back in last year to a group of physicians. I think it was in August, September, I can't remember. And at that time, I pulled up information at the Children's Hospital in Atlanta, and it was really something. They had like 30 cases of flu, when usually they would have like 700. You know?
Yes. Mm-hmm.
And so it really has, we don't know, is it that SARS-CoV-2 has bullied its way by being a bully and muscular might and suppressed other viruses that usually surge in this cold weather? Or is it that our behavior, and is it that our behavior has changed the way the virus is transmitted? So I remember a patient the other day, I was shocked. I was doing a 3-year health check, 3.5-year-old kid, and I said, pull down your mask, and the kid went like this, because I wanted to check the child's mask, a mouth. Yeah. And the child said, went like that, and mom said, it's okay, you can pull down your mask. And they pulled down their mask slowly, and as soon as I was finished examining their mouth, they quickly pulled up their mask. I was like, oh my goodness, this 3-year-old is trained more than an adult.
Yes.
And so if you have 3-year-olds already doing all these mitigation type behaviors, because remember, that is what's going to reduce the spread immediately. And so if we're doing all these things, we're definitely going to see a suppression of transmittable diseases. And then another example is when school gets in September, we usually see after 2 weeks a jump in strep throat. And the practice is full of people with strep. And for those of you who have kids, you know that that's when you start carrying your kids to the doctor's office. 2 weeks after school's open. Ear infections, diarrhea, vomiting, everything starts 2 weeks after school, or a week to 2 weeks after. Well, guess what happened this time around? I was almost out of business.
Wow.
You know? So that's happened is that we've kept them away from each other, plus then they have new behaviors now as far as how to reduce and prevent contamination.
Would you recommend any type of supplements or vitamins to take in the prevention maybe of COVID-19?
Yeah, so that's a good question. There is no supplement that has been shown to make a difference as far as preventing you from getting COVID. Now, that doesn't mean it doesn't do that. There's nothing that has been shown, okay? So I wouldn't tell anyone, go take this. What I'd say is that what they're doing, based on other studies that have been done with severe respiratory disease, when a patient is hospitalized with severe COVID in various models of treatment around the world, vitamin A, vitamin C, and vitamin D have been used as supplements. There are lots of theories of how they may help with the better handling of infections, but whereas to prevent, I would tell you right now that we know that a body which is well nourished and has good health, globally speaking, will less likely succumb to any infection than someone who's malnourished. And there's various studies that show that. And we've seen that already with people who have comorbidities, people who have chronic diseases. They are 12 times more likely to die and 6 times more likely to be hospitalized from COVID. That's why healthy people, the majority of healthy people, are not the ones that get hospitalized. So there's something to say about that. However, let me just warn you, if I have COVID and I come in your house and I'm talking around in your house and without a mask on my face, I don't care how healthy you are at high risk if you don't have a mask on to get COVID.
Okay. Also, I had a coworker who was concerned, and I liked, it was interesting to know that the vaccine timeline is 14 years.
Yeah.
I wasn't aware that it really took, I knew it took time, but not at that length. And to see how quickly the vaccine, our COVID-19 vaccine, was developed. And I think that was what was scaring a lot of people, that it was so fast. And and then especially in our African American community, you know, so many are leery, and they're saying, oh, that vaccine came out too fast, and you know, how do we know it's not, you know, if it's right? And they're so skeptic right now of it. And how do we?
I think that's really good questions, and I really understand that, because what they did with our people with the Tuskegee study was terrible, and other things that they've done. It's disgusting, and it's just inhumane what happened, and it should never be repeated to any groups of people.
Yes.
And we should speak very clearly about that kind of thing, and we should protect ourselves from that kind of thing. And that's why protecting ourselves means we should be informed. And I showed a graph that showed that 60% of this population is mostly white in race, 18% is Hispanic, and 13% black. However, 36% of the burden of disease is with whites, and 33% is of Hispanics, and 22% have the burden of black people, which means that people of color, Hispanics, and African Americans are taking the toll on this disease. Yes. It's killing our people.
Yes.
When you go, I mean, I have a colleague many colleagues in New York, and one of them said to me one day, he called me and said to me, Fitzroy, he's in charge of an ICU. When we were in the storm of infection in New York and people were dying by the thousands every night, he said to me, my hospital is only filled with Hispanics and black, and they're dying. And he said, I can't find anyone other than a black or Hispanic that's dying in his ICU unit. So there are multiple reasons for that. And we can get involved in that in a major way. I can get into socioeconomics and historical disadvantages and all kinds of things. But it behoves us to recognize that we need to use this information to our own benefit. So, for example, this vaccine was developed most recently by a black woman. Did you know that?
No, I did not. Yes,
this COVID-19 vaccine was, her name escapes me right now, but she works at the NIH, and she's one of the main persons behind the development of this vaccine. And while we're talking, I'll look for her name, but certainly she is a person that has done a lot of research on this, and most of us in the area of infectious diseases, people of color, have seen that this vaccine has been held to the same standards. And it's just that we have seen death and a tragic situation, that what we have done, we've used current day science and common sense to produce this vaccine. Because can you imagine it? We used to wait until we had done all the phases before we built factories.
I can't even imagine how many deaths we would have had waiting.
Oh my goodness. We would be in a mess.
Yes.
I mean, we would be in a mess. I mean, I want to I'm going to show my slide again, my screen here.
Okay.
Let me see if I get to it. Here we go. And you'll see here, this slide here blows my mind when I look at this slide here.
Yeah, that blew my mind too.
This is crazy. I mean,
yes.
When you see, this is what we had before. and this was way down in building building factories. You're looking at 8 to 10 years out, right? But when you look at what we did now, we started to build the factories way before that in the preclinical phase. So in other words, we made a bet. We made a bet and we said, you know what, if this works, great, we'll be ready for it. If it doesn't, we've lost the money, but we've tried. Yeah. And so that's why this is here. The manufacturing started when we started to see, hey, you know what, this is effective and it's safe. We just need more information. And so we didn't approve it until we went to phase 3 and we started to say, wait a minute, we're seeing, and I showed you the graph where we saw that, I showed you this graph when we saw that in the study, we saw this red line that people who got the vaccine were having less and less and less infections, whereas those who had the placebo, their infections were off the roof. At that point in time, you have to say, you know what, let's get this going. Yeah. And that's what happened here. So yes, we need to recognize that we moved at a fast pace, but it was with caution, with all the necessary steps involved to get a safe vaccine in place. We did not change any of those steps to get there.
Wow. So that, even though it was just a 1 year, we were able to go through every phase.
That's exactly right. We were able to go through every phase and make it happen like this.
Impressive.
Yeah.
And so with the COVID-19 vaccine being at 95% effective, so what are we really saying about that 5% that's left over? So
nothing is it's talking about in the clinical trial. It's okay. Talking about in the clinical trial. This efficacy deals with what you saw in the clinical trial, 95% effective. However, in the effectiveness, which is in the real world, and I can talk to that right now, because now Israel, we have about, I think, 15% of our population vaccinated. Well, guess what? Israel has more than 45% of their population vaccinated. Oh. Did you hear that?
Yeah,
imagine,
like 45%.
Imagine, go ahead.
No, I'm like 45%.
That's right. Imagine if we could get 50 or 60% of the African American population vaccinated. You would see figures drop. And I'm going to tell you something. They've had a frightening drop in the amount of people on ventilators within 6 weeks. Unbelievable. They've had an unbelievable amount of drop in patients admitted to the hospital, 10 times less in 6 weeks, because they're vaccinated more than 45% of their population. And listen to this one. And I'm looking at my notes here because the paper came out, and here it is in the New England Journal of Medicine, February 24, which is what's today? February what?
February 27th.
Yeah. So just recently, they had their study group had 1,000 people, and oh my goodness, they saw massive drops in their rates of hospitalization and the use of ventilators. And they found they had 94% effectiveness for symptomatic COVID. So that tells you then that they're very close to that 95% efficacy. Yes. So in the real world situation, not 40,000, which was used in the Pfizer, and 35,000 people in the Moderna, we're now looking at more than a couple million, probably 4 million, because their population is 9 million. And so they're looking at least a good 4 million people that they did the study in. Our information is going to be very robust now because we have more than 40 million people vaccinated in the US. So they're gathering that information as we speak right now, and it's looking really, really good.
Wow. Do you think maybe we could have more people vaccinated? But I feel like we're going through like a phase. So we're doing healthcare workers.
Yeah.
And, now we're trying, and, we're doing our 65 an older group. So when could the 50-year-old look to know when they can get it? How far away is that?
So that's a good question. And you know what? From what we're seeing, and I'm just talking about from the information we have, it's very hard to say, but with the J&J coming out right now and just being a one vaccine dose thing, that may allow things to happen. And by May, June, things may happen very, very quickly. And that's looking like where by July, August, it looks like most people are going to have most of their vaccines by then. Younger population below 40, that's looking much later, but I don't know.
Wow. Okay. So it's that much later for the younger folks. Okay.
Yeah. And that also depends on what happens with the supply chain. And look what happened with Texas. I mean, if you keep having situations like weather in Texas and things like that, that slows things down. But right now we're at 1.5 million doses per day that we're doing, which is very, very good.
Wow. I'm gonna look to see. I don't see any more questions on our chat. So if anyone does have a question, please be sure to put it in our chat room and we can continue with more of your questions. Right now, in your own practice, have you seen any children or a number of children have come with positive for COVID?
Yeah, well, a month ago, we never had many.
Okay.
Now we have a whole lot.
Wow.
We now have a whole lot of kids who are infected, and they're mostly like 7 to about 19, 10, 11-year-olds are the most common ones. The ones that get sick with it are usually like the 15-year-olds, and they're usually overweight as well. But yes, we are now seeing it. And so as far as telehealth, which is what we're doing for them, every day we're having 3 or 4 of those. And it's never just one person in the family. If there's 4 kids, it's usually the 3 kids of them infected. And one kid has a little fever and the other one's coughing. The other one has fever and headache and tummy ache. So we're seeing it now.
Mm-hmm.
But certainly not at the rate that the community positivity is for adults.
Okay, I think I have another question. Okay, hold on. Someone asked, is the COVID-19 vaccine a way of the government tracking us?
So I understand where that question is coming from, and thank you for that question. It's an important question, and we need to address these questions, and we need to take it serious because a lot of lives have been lost and are being lost. We're losing a lot of our loved ones and our family members. Our parents are getting sick and maimed and dying from this disease. And so this is a very serious question. And right now, our vaccines that are produced have no microchips in them. We do know what they don't have. They don't have any protein. They don't have any zinc. They don't have any preservatives. They don't have any thimerosal. And so they don't have any chips in them. And we must be aware that around the world, people are succumbing gravely to this infection. And for those of you who haven't lost a loved one, it's a very sad thing. And to see some family lose sometimes multiple family members within a short period of time is tragic and very real. I had one patient this week who really said that she wants to tell the whole world that this thing is very real. She had COVID back in October, and now she can hardly speak. And she's only 35. And she did not believe that this was a real illness. And she got hospitalized and got intubated and stayed in the hospital for 3 months.
Wow.
3 months. And had kidney failure, lung failure, heart failure. And this is real. And so this vaccine has been produced in response to benefits outweighing any other situation that could arise from having, let's say, a mild allergic reaction or having an infection on your site of inoculation, or feeling headache, or like what I had, joint pains, or even missing work for 2 days, that kind of thing. I think the benefits far way out that. So no, there are no tracking devices in the vaccines.
Okay, I have a ton of questions on our chat room. I apologize, everyone. I didn't refresh my screen, so I do see your questions. Someone asked, what causes the tiredness and the muscle aches and the pains from the vaccine?
That's a good question. And that tells you that your immune system is working well. That's the first thing. That's where you get it from. In other words, there are certain immune elements that we have that respond to a foreign agent, and it attacks it. One of those cytokines, we call it, interleukins, those cause fever, and they also cause discomfort in your joints. And it's some of these immune elements that we have that respond by doing that. And they usually cause inflammation. And that's what you're seeing. It's a body's response of type of inflammation to this foreign agent that has gotten into you, which is a way of tricking the immune system to think that you have the virus, but you only have a portion of the virus that it's going to be able to just give a primer to the immune system.
Another question was, this is from Brian Philpotts. Fitzroy, yeah. Thanks for doing this program for our Mount Calvary members and viewers. It says, what is the ideal vaccines for different age groups and why?
I think that the vaccines, are we talking about when they were rolled out? I'm not too sure, but anyway, right now they're giving it based on different things, your age and your job. And I don't know if the question is related to that, but it's being given, a decision has been made, an medical ethical decision has been made at that age group. However, why is it 16 and below versus 18? Sorry, 16 and above versus 18 and above? That's a decision that was made by each company when they made that vaccine. But we know that, generally speaking, we treat in the world of medicine, as far as dosing and immune response, people who are usually 17, 18, the same as an adult. And that may be where the question is coming from. Because when it comes to dosing for someone who's 16, 17, 18, we basically give them adult doses. And that could be the reason behind the response that we allow them to get the vaccine or being part of the trial at that time. But certainly below 16, the immune system acts differently. And that may be the reason, and the reason why now we're going to be slowly going down, now that we've seen probably that it's a safe vaccine.
Sorry about that. It went out and I was like, help me. Okay, are we still going? I'm sorry. Sorry about that. My computer went out. I do have another question. Why do some vaccines have 1 dose and others have 2 doses?
That's a good question. And basically, most mRNA vaccines, so far we've noticed that when they produce their response, they seem to be short-lived versus live. Whenever you live or attenuated mean that you've kind of weakened the virus. When you give someone a cold virus, like adenovirus, and you put genetic instructions in that virus, and then you inject that into a person, which is like the J&J vaccine or the AstraZeneca vaccine from England, the body reacts more aggressively to that live virus vehicle that was used to put into your body. And so your body responds more aggressively. And so your immune response is much more aggressive, and that lasts a little longer. So it's the type of vaccine that decides how long sometimes the immunity lasts and if you need a second dose. So you'll find that most of those mRNA vaccines, they usually require 2 doses, whereas the other live virus vectors are going to be 2 doses.
Yeah, and I think the Johnson & Johnson vaccine is just a 1 dose.
That's correct, because it's a viral vector.
Yes. Someone asked if you had a mild stroke or any ailment, would it be safe to take the vaccine?
There is no contraindication that we know right now, but if you're currently going through a cardiovascular disease event, that's something you should speak to your primary care about before you make that decision. But someone who has had a history of that shouldn't be a problem.
Okay, so currently there's no disease that precludes anyone from getting the vaccine at this time?
Not that I know of. However, there are, if you're currently having an illness, that's a different thing. You know, if you have severe allergic reactions to certain things. Life-threatening, yeah.
Okay. And a few more questions. I'm allergic to penicillin. Would it be okay for me to take the vaccine?
Yes, there's no relationship between that. However, if you get severe allergic reactions to a vaccine, to any medication, you have to be aware that you can be at risk for having allergic reaction to another medication, but you may still get vaccinated. You may still get vaccinated even though you may have severe allergic reaction to other oral medication. That's the answer.
Okay. Do humans produce reverse transcriptase, allowing DNA segments to be produced from RNA segments?
No, they do not. So when people ask the question, if I get mRNA, is my body going to use this enzyme, like the one you mentioned, to then reverse it into DNA and then decide to start, then that DNA begins to make all kinds of crazy stuff? Our body does not have this reverse transcriptase, and so it will not be able to change anything to DNA.
Okay. Wow, everyone has some really great questions on this chat. It says, why is it believed that our post-COVID-19 infection immune antibody memory is believed to last a shorter time or duration opposed to its duration after vaccination?
Yeah, so you're looking at, the question is natural disease versus vaccination, right? Interesting. And that's a good question. But remember, I mentioned that the mRNAs, those type of vaccines, in the studies that were done before now and have been done long before, it had been noticed that they didn't have that long of a immune response like your chickenpox vaccine had, you know, or the MMR vaccine had. And then we're also noticing that even natural illness in itself, after 3-4 months, is waning when it comes to your protective antibodies as well. But we may never know. You know why? Because the vaccine itself, the virus itself is changing. So that in itself may be a part of what's going on as well. Just to make things a little more confusing. How about that?
Yes. Someone wrote that it's Kismika Corbett. I'm not sure if I'm pronouncing her name. Is the Black doctor's name, I guess, that developed the COVID vaccine.
What's her name? What's her name?
Is it Kismika?
Yes, right. Kismia. Yeah, that's right. That's her.
Okay.
Yeah.
So everyone look her up, Kismika Corbett.
That's her, Dr. Corbett. Yes, right.
Another question was, how do we accelerate the rate of the vaccine?
What do you understand that? I'm not sure if I understand it. Do I?
I don't know. Maybe in terms, how do we accelerate it? I guess maybe in terms of.
You mean vaccination?
The vaccinations, yes.
I
don't know. We're going through phases right now, so I really. I guess maybe each group will just have to wait until it's their time.
Well, I mean, what Israel did, they have a smaller population. Remember, we got 331 million people in this country. And let's, so let's say you're going to vaccinate 200 million of them. That's a lot of vaccines. But acceleration has to come with coordination. And when you have, from what I've seen from other models around, and there are places in this country where people are getting vaccinated very quickly. And there are cities around the world where people are vaccinating small cities very quickly to see what the effect would have. Like there's a city in Brazil, a small city where they're doing that. But yeah, it would require for us to then not look at your job or looking at your age and just vaccinate blindly, But that's a difficult thing. Yes. And then remember, a third of people, or even more than that, are doubtful of vaccinating themselves. So that's another issue.
One person asked, well, this really isn't a question for you, Dr. Graham, but it says, why hasn't our clinic took on this project in terms of a site? I am working with the Department of Health to possibly have us as a site for the vaccine. So that's to be in the future, and I am working on that. So, and that has been all of our questions. I hope that I have answered everyone's questions. I apologize for my computer going out and not seeing your questions.
I do, if I could just mention, I want us to be aware clearly that people of color have lots of alienated and disadvantageous situations that put them on the front line or allow them to be more exposed to this infection. And with that in mind, we need to seek information with your primary care, or when we get together in these kind of forums, and be informed so we can protect ourselves and our families. Because it's a sad day to see how many of our people are really dying and being made sick from this disease. It's a devastating rate and very frightening. Information is power. Before now, people controlled power and we never had it. Now we have the information and we are part of making this happen, even to the point where a black doctor, Dr. Corbett, was involved in the actual development of this vaccine, the main person. We should be proud of that, and we should work towards trying to inform our community of the safety so far that we've seen and how it's held up so far. Remember that this vaccine will give you side effects. I had them and I felt achy. This vaccine, like any other vaccine, can give you side effects, and you can have bad allergic reaction, and I would not be shocked if people have severe and even mortal from anything, from a food or from a Tylenol. Right now, the most common reason for liver transplant on the transplant ward in the hospital is Tylenol. But how often do we use Tylenol? Very frequently, but it's one of the most common reasons for liver transplant in kids. Mm-hmm. So we have to recognize that there are risks in everything, but we have to look out what the benefits outweigh the risk in these very, very unprecedented times.
Yes, I totally agree with that. Totally. And I think in the Black community as well, we just have a health literacy issue as well. Just you're not knowing the information, and I've always been told, you know, you do better when you know better, and the more we get this information out, the more we can help our community. So we just got to keep having forums like this that will spread the word. There was a comment, someone said that some believe vaccines will keep me from getting and passing the virus to others. Is that true or false?
That's a very good question, and we're getting some answer. Before, it was clearly the clinical trials did not show that it prevented transmission. However, guess what? A study on Friday came out from Cambridge in England of a hospital that did a very interesting study. They were using the Pfizer vaccine, the mRNA.
Mm-hmm.
They had 1,000 of their staff who they vaccinated already, but they had a habit of frequently testing them. And they had 1,000 who hadn't been vaccinated. And that's since December, mid-December until now. And guess what they found? They found that there was decreased transmission on those who got vaccinated.
Mm-hmm.
17 down to 4 transmissions.
Oh, that's really...
that's interesting. That shows us then that even people who are asymptomatic, watch out for that, because those are people who
yes.
feel okay, they go to work, but
mm-hmm.
you test them and they're positive.
Yes.
There was a decrease. There was a decrease in transmission between those who are vaccinated and those who are vaccinated. Same people working in the same environment.
It's interesting because I work with a vulnerable population at work, and at the hospital, I'm actually still getting tested once to twice a week, even
That's right.
though I've had the vaccine.
Yep.
So
same study. It's the same study.
Yeah, same study.
Yeah,
so
that answers that. So it's not known as yet, but these studies are coming out. And just go and Google and look at English studies showing reduction in transmission of COVID, and you'll see that come up. It's not peer reviewed as yet, so it's just on the internet as a document, but it will be peer reviewed soon. But it's a study that came out of England, published Thursday or Friday. I think it was Friday.
I don't see any more questions. There was a comment saying, "Thank you, Dr. Graham, very informative, which alleviated any lingering fear of taking the vaccine." And I think that's what we're trying to do. We're trying to alleviate fear and let you be able to make a sound decision on your own about getting the vaccine.
Yes, people need to be informed. I strongly recommend the vaccine. I showed you a picture of myself taking the vaccine.
Mm-hmm.
I strongly recommend it to my patients. But I'm very much aware that every person has to make their informed decision. I hope my role here today has been to give the facts as we have them now and make a sound decision based on that. And I want to be a part of giving the information that's available now as far as the facts that we have available.
Yes, and I'm a witness too. I've had it too. And my job here is to let you all be informed so that way we can slow down the rate of COVID-19. And I hope to be able to work with the Department of Health and in getting the vaccine to our underserved and our vulnerable populations. So stay tuned for that, everybody. It's coming soon. I just want to thank you, Dr. Graham, for taking your time. Thank you so much for coming here.
Pleasure.
You've answered every question. I even know more about the vaccines than I did before. So I appreciate you just taking the time. And on behalf of Health Ministries, thank you.
No problem. I want to invite you, just in case you'd like to hear more about it. Next week, I'll send a link to you, but next week I'll be in England, but not in person. Don't worry. I'll be in England. There's going to be a group of other physicians joining us on another forum like this with other specialists as well. And we're going to be looking at vaccination and also to do lifestyle as well. And it's what I'll do, I'll send you the link. I think it's going to be 1 o'clock or 1:30 our time, which would be 5:30 English time. So, but I'll send you the link.
Yes.
And if anyone wants to join that, but it's going to be a very, very exciting one because I know the physicians on that format is going to be, they're really geared up with lots of good information, and they have a wide background: cardiology, epidemiology, public health, and lifestyle medicine, like myself. And it's just a wonderful thing to see right now that it's the time which I think churches like the Seventh-day Adventist Church, which has been given a message in its early formative years on preventive health or curative health with lifestyle. I think this is a time where we need to share this information. I went into some of it very briefly, but many of the discussions and talks that I'm involved in look at a very, very cellular level and molecular level, how we literally can modify the way we deal with our immune system by our lifestyle. I mean, for example, when you look at, let me give you an example, someone who's not sleeping well, who has chronic sleep deprivation, it has been shown that they have decreased levels of CD4 cells. CD4 cells are what we use to fight viral infections like HIV, like COVID-19.
Wow.
So just by having a chronic sleep problem, you have decreased levels of the most important cells that will help you to fight viral infections. And we can go on and on. There are multiple things that I can talk about. For example, you may or may not know this, people who live in environments with green vegetation, trees, who live in areas which are more suburban or country-like, they literally have immune system which are more robust to respond to vaccinations.
Wow.
Not only that, it has been seen that the HPA axis, which is their hypothalamic pituitary adrenal axis, which deals with stress, they have a more lower level of cortisol baseline and stress levels just by being exposed to vegetation and greenery. That is why when we're born, like myself, I was born in the middle of London in a concrete jungle, you have a different immune response to illnesses and to vaccination. I could go on forever.
Okay.
But
well, that's okay that you could go on forever. That just means I need to have you back here for another forum. So no, that's good. So I definitely want you to come back to us and enlighten Mount Calvary and our others that are watching and viewing.
Sure, and that would be
necessary information. And
sure, we would love to do that whenever possible.
And so everyone, if you have liked what you heard, like what you've seen, I'm asking that you like, share, and subscribe to Mount Calvary's channel, where we are bringing you the latest information on worship and health and everything else. So we just want to thank you all for viewing. We thank you for writing down your questions. I hope that this has been informative. I hope that you've gotten something out of this. Based off of your chat, Dr. Graham, people are saying excellent information. Thanks, kudos. I'm really feeling the love from all of this, and people have really shown that this has been informative to them. On behalf of Mount Calvary Health Ministries, we thank you. And that's all, folks.
Thank you.
Have a good evening.
Bye-bye.